Hi, my name is Dr. Jenny Maxwell and I work at M3 Health in Hobsons Bay. So a Mirena is an example of one of the many contraceptives that we can use. It works by releasing this hormone into the uterus where it acts locally in many different ways to help us prevent falling pregnant. The device itself, and I always show this to my ladies because when you get it from the pharmacist it comes in a huge box, but the Mirena itself is very small. So it's a T-shaped device, which you can see here. So it's actually quite a small device. And this is the real life size of it. It sits inside the uterine cavity, and that in itself helps prevent any potentially fertilized egg from becoming implanted in the endometrium. The hormone is released from this little area here in the T-bar, and that hormone as well can cause changes to the cervical mucus, which makes it thicker, preventing sperm from entering the uterus. So the Mirena is over 99% effective at preventing pregnancy. It's also 100% reversible and easily removed. So when you are ready to fall pregnant or the time is right for you, it can be easily removed. Any woman who is considering her contraceptive options could have a Mirena. It's not just for women who have had babies. Lots of women who've never had children or delivered vaginally can have a Mirena. Many women who are considering Mirena as a choice of contraception will choose to have and should have a consult with their GP prior to the insertion. The idea behind that first initial consult is that you get to have a discussion about all of the different options and whether or not it will be the right choice for you. We can also discuss what the procedure involves, any costs that may be associated with it, and all of the benefits and potential risks of the procedure. We have a special room set up where we've got a special bed which is comfortable for our ladies. The procedure is like getting your traditional pap smear or cervical screening test performed. We do use a local anaesthetic spray to the cervix to help with any discomfort, but often women may experience some period-like cramping, and I always recommend that you take some painkillers before you come, which can really help reduce those symptoms. The procedure is like getting your pap smear done. The first important thing that we do is we want to know whereabouts your womb lies, so we do an internal examination to make sure that we know where we're going to be placing the Mirena. It's then important to measure the length of your womb, and that's different for every woman, but is often between 6 and 8 centimetres. Imagine this is your womb, and this is life-sized. Once we know how long the area is of your womb, we can insert the Mirena device. So it's a very simple procedure where the device is inserted through the cervix, the Mirena is opened, and it's left behind. Okay, so the procedure itself is actually very simple and very quick to do. These threads are then left, so these come through the cervix, and we cut them, and I tend to cut them on the longer side. Sometimes what can happen is the threads can disappear up into your cervix, which can be up to 3 centimetres long, and we don't want that to happen, so that when it comes time to remove it, the removal procedure is easy. We keep these a little bit long, we cut them, and they tend to sit high up in the vagina, not causing you any issues, and you're not aware of them day to day. Removal procedure is very simple. Again, it's similar to having your pap smear done, a similar position that you'll be lying in, but all we need to do is to grasp the threads with a device, and then we just pull gently, and the Mirena comes away. Very occasionally, if a lady has very, very heavy bleeding following the insertion procedure, it can sometimes be expelled or fall out, but that doesn't happen very often at all. In fact, I've not seen a case of that. So the Mirena should be replaced every 5 years. It can be removed earlier than that, but yes, the length of the efficacy of the Mirena is 5 years. The side effects of hormones can cause different changes within the body, and it's important to consider that, but the amount of hormone that's present in the Mirena is much less than any of the others, and so the potential side effects are much less as well. Mirena doesn't interfere with sexual intercourse. Your partner will not be aware of your threads. We will teach you how to feel for them yourself, and we do encourage that you do that, but you won't be able to feel them day to day, and your partner will not be aware of them. So the hope is that for most women, as a happy side effect of the Mirena, you no longer have periods. That can take up to 6 months, and for the first 6 months a lot of women will have irregular bleeding, and that may just be light spotting, or it could be a regular period. Often after 6 months the bleeding will have settled to none at all, but for some women they do continue to have a light period. If you'd like to book an appointment, please go online to the M3 website and you can book your initial consult to have a chat with one of our GPs.